My presentation tomorrow will cover the development of PARP inhibitors, which is a new class of drugs that's been approved for the treatment of a subset of ovarian cancers. This work was back about 15, 20 years ago, where PARP was identified as a key DNA repair enzyme, and PARP inhibitors were developed to produce what is known as synthetic lethality. Synthetic lethality is when you have two different pathways and you inhibit either one of them, you don't do anything. But if you inhibit both of them simultaneously, you'll kill the cells. And that's the way PARP inhibitors work. When they inhibit PARP in the setting of a tumor cell that has a mutation in BRCA1 and 2, you get cell death. So this creates an enormous therapeutic window. This work migrated into the clinic very rapidly, and of course ovarian cancer was an ideal tumor. And the reason is because ovarian cancer is really a disease of genomic chaos. It has a severe defect in DNA repair. It's ideal for PARP inhibitors. The first trials, the phase 1 trial was published in the New England Journal about now 10 years ago. And then two major trials were just completed. One was published in the Journal of Clinical Oncology by Kaufman et al., which treated germline mutated patients across the board, a number of tumor types, but the response rate was quite striking, and this led to the FDA approving the drug in 3 lines or greater in patients who had germline mutations of BRCA1 and 2. A parallel study called Study 19 looked at the use of a PARP inhibitor in maintenance after the treatment of platinum-sensitive recurrence. That trial also was positive, and it went to the EMA, and the European agency approved the use of that drug. That use has not been approved in the United States yet. So where are we going now? There are at least 2 other PARP inhibitors that are coming forward in trial. Some exciting data was presented at ESMO from the NOVA trial, which is clearly positive, and I think will lead to FDA registration of that drug also. And then Ariel 2 has already been presented several times, and that data is also in front of the FDA for the approval of a 3rd drug. And the future for this is, we're not going to stop there, obviously. The future is now creative combinations of PARP inhibitors with other agents. And so what you're seeing is certainly several trials combining PARP inhibitors with anti-angiogenic agents like bevacizumab. One is Avenova, which is already open in Europe, and we're going to be opening it here in the United States. Another really unique and creative combination is the combining PARP inhibitors with immunotherapy like checkpoint inhibitors. The idea there is that those tumors that have homologous recombination defects, which are the ones that are responsive to PARP inhibitors, would also have a lot of mutations, and they may be immunogenic.